Now we move on to craniofacial anatomy part 2. So in this craniofacial anatomy part 2, we have facial bones. So we will read about facial bones. A quick recap about what we read about the number of bones. We know that cranium is made of 8 bones and facial bones are totally 14 in number. So that is what we are going to quickly read through about the facial bones. Additionally, we will also be reading about the sutures, the foramina and your sinuses. So the first one is about the nasal bone. So we all know that we have a very prominent nose, but in that nose only this particular region is made of the bony structure, whereas the other part is actually cartilaginous. So it is a cartilage. Cartilage is actually neither very soft nor very hard of a bone, it is intermediate. So all these blue color shaded area is actually the cartilage. You can see that this fluorescent yellow shape, yellow colored area is actually the nasal bone, whereas the blue shaded one is your cartilage. So the nose, actually the bony part of the nose is your nasal bones, and it is actually containing 2 nasal bones. So the meet in the midline to form the prominent part of the bridge of the nose. So this particular region is your bridge of the nose, and it protects the openings of the nares and supports the pliable cartilage area. It articulates, the nasal bone articulates with 4 bones, that is your frontal bone, the ethmoid bone, opposite nasal bone and the maxilla. So we can see that in the picture here as well. So it articulates on top with the frontal bone and on the inner aspect with your ethmoid bone, we just saw that, and on the opposite of nasal bone with the opposite nasal bone and the maxilla here. So there are 4 bones which actually are articulating with the nasal bones, that is your frontal, the adjacent nasal, ethmoidal and your maxilla. And now we move on to a very interesting bone of the face, that is your zygoma. So this zygoma is also called as the malar bone or the cheekbone. So this is your malar bone or cheekbone. So it is very beautifully represented in this particular picture. So it is also called as cheekbone, and it is said to have lot of aesthetic value. If you have a very prominent cheekbone, the face looks more aesthetically pleasing. So the shape of this zygoma is actually rhomboidal in shape. So you can see the rhomboidal placed over there, and it is located below each eye, and then it forms the lower lateral margin of the orbital cavity, lower lateral orbital region. We saw earlier the frontal bone actually formed the supraorbital margin, whereas then we have the lower lateral part of the orbit being formed by the zygoma, and then the extension of the zygomatic bone with the process of the temporal bone attaches it to form an arch-like structure called as the zygomatic arch. So this is very important. Here it actually attaches with your temporal bone. So this is very important. You have your arch-shaped extension attaching it with your zygomatic arch. So where all does this zygoma articulate with? So it attaches with your maxilla, attaches with the frontal bone, the greater wing of sphenoid and the temporal bone. Similar to what we saw earlier about the nasal bones, this bone also articulates with your 4 bones, that is the first one is your maxilla, it attaches to the maxilla over here, greater wing of sphenoid at the center at the midline, and then we also have the frontal bone attachment at this point, and then the temporal bone attachment at this particular area. So it is a very relevant important bone, because in maxillofacial trauma, whenever there is a trauma, zygoma gets fractured very frequently. So it forms a very important part of the facial architecture. Now we move on to the palatine bone. We all know that the palate is bounded by the palatine bone. This contributes to formation of the posterior third of your hard palate. Having mentioned palate, please do remember that palate is formed by the hard palate and the soft palate, and it is also contributing to the posterior formation of your hard palate, the orbit and part of the nasal cavity. So this palatine bone is actually L-shaped. You can see that it is L-shaped, and it contains the greater palatine foramen and 2 or more smaller lesser palatine foramen. So, foramen are actually small holes which are helping to allow the exit of some nerves and blood fibers and blood vessels. So, foramina are nothing but small hole like structures which allow the exit or entry of nerve fibers or blood vessels. Sometimes they are large enough to allow other larger structures as well. So, these is about your palatine bone. And then we move on to lacrimal bone. Lacrimal is one of the very small smallest of the facial bone and forms the anterior part of the medial wall of each orbit. So, you can see that it forms the anterior part of the medial wall of the orbit. So far we saw the supraorbital margin formed by the frontal bone, and then the lower lateral being formed by a zygomatic, and now we have come into the midline part, the medial part. Anteromedial is formed by your lacrimal bone, and each bone has a lacrimal sulcus that forms the nasolacrimal canal. So this is a very small bone in the among the facial bones, and it actually has or contributes to the anterior medial wall of the orbit, and the bone also has the lacrimal sulcus which forms the nasolacrimal canal. The next one is about the nasal concha. So far we saw that there are 3 concha. We had already looked upon the superior concha and the middle concha, which were actually part of the perpendicular plate of your ethmoidal bone. And now we move on to see about the lower nasal concha. So this lower nasal concha is the largest of all the concha, as the name suggests. You can see the position. So these two are smaller than this. So this is a lower nasal concha, and it is scroll shaped. So it is like a scroll, and then it is actually protruding medially from the lateral walls. So having said that, so these are the lateral nasal walls. So this is the nasal septa at the midline. On the sides we have the lateral nasal walls, and below lie your superior and middle concha. So concha are 3 in number. Among them, the lower nasal concha are largest, the upper and middle are smaller, and they are actually forming a part of the ethmoid bone. The lower concha is actually lying slightly at a lower position, and it is large in shape. Actually they form the part of all of them are actually forming the part of the lateral nasal wall. And then we have vomer. Vomer is actually a flat bone which is actually seen here. It is a flat bone which is actually forming the posterior part of the nasal septa, or the lowest part of the nasal septa. So you can see that it is again shaded over here as a green shaded one. So it is actually a flattened bone which forming the lower part of the nasal septum. So please recollect that the upper part of the nasal septa, which was already studied during the reading of the ethmoid bone, is actually nothing but the perpendicular plate of the ethmoid bone. So that perpendicular plate of ethmoid bone is actually forming the upper part of the nasal septa, whereas the lower part of the nasal septa is formed by vomer, and this supports the septal cartilage. So you can see the blue shaded area of the bone. So that is your septal cartilage, that is this region. So we know that this is only the cartilage. So that is supported by 2 bony processes. One is your vomer and the other is your perpendicular plate of ethmoidal bone. And now we go on to quickly look into the main area, the orbit, which contains the most important sense organ, that is your eyes, which is responsible for vision. So we have the orbital part which is being made of a lateral wall, a medial wall, a posterior wall, a roof and a floor. We are already familiar with parts of the orbit already because we have touched upon other bones as well. So what forms the lateral wall? So what forms the lateral wall here is your zygoma. So this is your zygoma, which forms the lower lateral portion of the orbit, and then we have the medial wall here. So medial wall is actually formed by the maxilla, the ethmoid bone, we can see that this is the maxilla, and then we have your ethmoid and the lacrimals. So, I am marking it as plus. So, these 3 bones actually go into forming the medial wall of the orbit. And then we have the posterior wall. The posterior wall is actually being formed by the greater wing of sphenoid. So, we have your greater wing of sphenoid present at the back, and that is actually helping to form the posterior wall of the orbit. Further, we have the roof of the orbit and floor of the orbit. So, roof of the orbit is formed by your frontal bone and lesser wing of sphenoid, whereas your floor of the orbit is formed by maxilla, zygomatic bone and palatine bone. So, these are very, very important because it houses a very important sense organ, that is your eyeballs, which is very important for vision. So, it is actually divided into 5 zones. So, the first one is your lateral part, your medial part, and then we have the posterior part, the roof and the floor. And now we move on to bones forming the nasal cavity. So, here again the bones forming the nasal cavity, as already seen in the concha bone reading, we know that there is a position like this. So, you can have an approximate figure like this. So, these are the lateral nasal walls, and then you have the midline septa. So, this is the septa. So, this is, I am giving a picture that's from the frontal view. What you are seeing here is actually the lateral process. What you are seeing is being shown on the other side. So, you can see a picture over here, which is hand drawn over here, and this forms the lateral aspect and this forms the medial aspect. With an overview like that, now we will go on to see which is the, what are the parts. So, we have the lateral wall, the nasal septa, those are the 2 important points, and then we have the roof, the floor and the bridge, and from here you know that there are 3 concha projecting from the lateral wall. So, these are the concha regions. So, what goes into forming the lateral wall? The maxilla and the palatine bone forms the lateral wall. Nasal septum is formed by your perpendicular plate of ethmoid bone, which we have just completed, and additionally nasal septa is contributed by omer. We know that it forms the lower part of the nasal septum and the nasal bone. And further we have the roof formed by ethmoid bone or cribriform plate and frontal bone. And further there is floor, which is formed by the maxilla and the palatine bone. Bridge is formed by your nasal bone at this particular region. So, you can see the nasal bone at this particular region, and then we have the ethmoid bone. You can see the ethmoid here, the crista galli was part of it, superior and middle concha, and then the inferior concha, which is actually a separate bone. And then we have the facial buttresses. So, what do you mean by buttress? So, buttress is actually a kind of area where that particular part of the bone is more stronger, good enough to withstand any kind of external forces more than any other part of the body. So, this kind of buttress is a region where there is some kind of a reinforced structural element present. So, the bone is more structurally more stronger at that place, so that it can resist and dissipate external forces. So, that is what they are important for. So, they are structural pillars and they provide stability and strength of the adjacent relatively weaker bones and protects the surrounding soft tissues. So, there are 3 buttresses. First is your horizontal, and then we have the vertical, and then we have the nasomaxillary. So, the horizontal contains your supraorbital rim and the frontal bone, and then we have the infraorbital rim, which is also contributing to the horizontal buttress, and then further we have the vertical buttress. So, the vertical buttress is inclusive of the zygomatic component and the maxillary component as such, and then we have the nasomaxillary component forming another important buttress. So, buttresses are structural pillars which are important and which are contributing to protect and offers strength to serve to protect the adjacent weaker bones and also to protect the adjacent soft tissues. So, these particular buttress are helping to resist and dissipate external forces which can happen at any time, any time. It can be a physical assaulting force, or it can be due to a maxillofacial trauma. And then now we move on to maxilla. So maxilla are actually paired bones. So we can see there are two maxilla here. So this is a very important bone of the facial system, because they are housing the most important part of the masticatory apparatus. Like how we said for orbital bone, it houses the most important sense organ. This maxilla is the one which carries the upper part of the masticatory apparatus, that is the teeth structures. So the maxilla are paired to in number, and then it contributes to the formation of the upper face, the orbital floor, lateral wall of the nasal cavity, floor of the nasal cavity, and floor of the oral cavity as well. So it forms a very, very important part of the face, and it actually, not only that, at the back, at the posterior region, it gives rise to, or it forms the roof of the oral cavity, again separating the nasopharynx and the oropharynx. So that's very, very important. So it actually is as a floor. And then we have hollow pyramidal structures with 4 surfaces, 4 process, multiple foramina, and a sinus. So these are very important, and the entire thing houses a very large sinus, that is your maxillary sinus, and then it is made of 4 surfaces, 4 process like extension, multiple foramina at the back, which we will be seeing now, and a sinus, that is your maxillary sinus, which is very, very important, and it is largest in the craniofacial system. The next important in the facial bone is your mandible. Both these maxilla and mandible are the ones which gives your shape of the face and determine the appearance of your face, and they are also important because they carry the masticatory apparatus with them. So mandible is an unpaired bone, and it is U-shaped in structure and forms the lower jaw bone, and it is very unique in many structural aspects. The largest, strongest bone of the face, and only movable face bone in the skull, that is, it can move. The other things you cannot move, only this can be moved left or right. So it articulates with the skull by pair of your joints, that is your temporomandibular joint. So again, wherever bone and bone articulates to one another, there will be a articulating area, that is your condyle. Remember, please recollect what we saw in occipital bone. We saw that there were 2 occipital condyles placed on either side of your foramen magnum, and then we have your condyles temporomandibular joint, condyles in your temporomandibular joint articulating with your temporal bone and your mandible. And now how are these structures taken care of? So the blood supply is actually taken care of by presence of blood vessels at the center, that is your endosteum or inside. So the blood vessels at the interior aspect are called as the endosteum, and those at the periphery are your periosteum. So these are very important. And then we also have epiphyseal arteries. So epiphyseal arteries are the ones which are there present at the articular or the non-articular surface of the bone, or at the ends, the terminal ones. And then we have metaphyses or metaphyseal arteries taking care of the other parts of the bones, which are the longer parts of the bone. And then we have nerves which are distributed freely to the periosteum and accompany the nutrient arteries. So there are 4 categories of arterial supply, that is the blood supply. What is there on the inside, what is there on the periphery, what is there on the articulating surface, and what is there at the longitudinal axis part of the bone. And then we have the sinus. So sinus is a hollow shaped space in the bone, which is very, very important. So the hollow space in the bone, as already said, is there present to give more resonance to that particular solid structure. It also helps in reducing the weight of the craniofacial system. So wherever possible, most of the bones will have a sinus-like space. So what does the sinus-like space contain? They are actually hollow and empty, and they contain only air. Rarely they might get infected or inflamed. At that particular time there might be some inflammatory fluid inside them. Otherwise, normally if they are healthy, they will only contain, they are hollow and they will contain air inside them. So the functions being, they lighten the weight of the skull, and they also lighten, they also help in resonance of the sound which is being produced by the voice apparatus. So, how many sinuses are present? The maxillary sinus is the largest of them, and it is present on the maxilla. We know that maxilla is paired, so there will be 2 sinuses present, and then we have ethmoid sinuses. Ethmoid sinuses are present on either side of the perpendicular bone, perpendicular plate of the ethmoid. We know that it is present exactly here, and it contributes to the upper part of the nasal septa. And then we have the sphenoid sinus present below your sella turcica, which houses your pituitary gland, and then we have the frontal sinus, which is inside the frontal bone, the 2 in number. So, these are about the sinuses. And now we are going into more in depth about the holes in the craniofacial system. So, these holes or spaces are the ones which are very important. So, that is your foramen. So, they are openings or holes which are allowing the passage of structures from one region to another region. So, we can see a very huge list over there. You can see the location and we can see the structures transmitted through it. So, we have a diagrammatic representation to show this in a better format. So, how do we go about reading this and understanding the foramina? So, foramen is single and foramina is plural. So, the number of foramens are categorized based on presence in the anterior cranial fossa, the middle cranial fossa and the posterior cranial fossa. So, if you see that this is the base of the cranium. So, this is divided into anterior, middle and posterior. So, in the anterior cranial fossa, which are the bones which are actually helping to form the anterior cranium. So, that is your frontal bone and the ethmoidal bone. And then what forms the middle cranial fossa? We have your sphenoidal bone, and that also you have your part of the temporal bone extending there. And then we have your posterior cranial fossa, which is contributed by again temporal bone, and then we have your parietal and occipital bone. So, in this there will be lot of foramina. So, that is what was given as a tabulated form, and this is a diagrammatic form. So, as already mentioned, the most largest foramina here in the skull, and not only in the skull, the entire body, is your foramen magnum. That is why it is given the name magnum, the largest. Okay. As already said, the foramen magnum is large because it has to allow exit of your spinal cord. And then we have the smaller ones, as in where the structure passing through is required. There are very, very smaller ones which we know that forms the cribriform plate, which actually transmits the olfactory nerve fibers. And then we have ovale, foramen ovale, and then we have foramen rotundum. Foramen ovale is for mandibular nerve, foramen rotundum is for your maxillary nerve. And then there are other foramens. We have your jugular foramen, which is slightly larger, and so on. So, all these foramina are very, very important. And why is nature placed such a number of holes here to allow so many structures to pass within and outside, is because the cranium houses the most vital part of the human body, that is your brain. The neural center, the control center is there in the craniofacial system. So, that control system has to be taken care of well, nourished well, and at the same time all the signals which the control system is exuding has to pass on to the entire part of the body. So, that is why there is such an intricately placed system of foramens placed over there. So, it is a very important area, and that is why we have lots of foramina like that. And now we move on to another very interesting area. We kept reading about the sutures. So, the sutures we saw earlier were at the sagittal plane, the sagittal suture, and then we saw one at the coronal suture. We know that the sagittal suture is actually connecting both your parietal bones, and then we have your coronal suture connecting the frontal bone with your parietal bone. So, this is what we were actually seeing. So, this is your sagittal suture and this is your coronal suture in the coronal plane. So, this is the coronal plane and this is the sagittal plane. And then we have other sutures which was already mentioned, that was lambdoid suture. So, the lambdoid suture is the one which is actually connecting the parietal bone with your occipital bone. So, these are the most important sutures. And then there is other important thing which is actually called as a squamous suture, which is connecting your parietal and temporal bone. Additionally, what happens is during birth, these sutural joints are actually containing very soft connective tissue like areas, and those are called as fontanelles. Fontanelles are softened areas in between two bones, and these particular fontanelles are very important to allow the expansion of the bony skull, so that as the brain mass increases as the child ages, the fontanelles allow that particular space for growth, and then as and when it is required, those fontanelles are closed in a particular sequence. So, the posterior and the anterior fontanelles we can see closes by 8 weeks, and then we have 18 weeks closure for anterior fontanelle. So, these are very important. So, 8 weeks being 2 months of the lifetime of a newly born child, and 18 months is 1.5 years in the lifetime of the newborn child. And then the few sutures which you already saw, we saw 2 squamous, 1 coronal suture, 1 lambdoid and 1 sagittal suture. So, we have quickly seen the craniofacial anatomy in 2 parts. The first part went on to discuss about the cranium bones, and the second part went on to discuss about the facial bones. Additionally, we also touched upon the sinuses, the sutures, the fontanelles, the foramina, and these are the references which can give you a very clear picture of this craniofacial anatomy, so that you can browse upon these references, and thank you for your patient listening. Thank you.